My name is Gyasi Patterson, and I'm the Director of Pastoral Care Services here at UNC Rex. November is National Hospice and Palliative Care Month. Palliative care means to cover, and it covers a wealth of pain management and also comfort care measures. But hospice is when we are no longer seeking curative measures. So the difference between the two would be that hospice is more of end-of-life care. I believe the presence that we provide, being at the bedside and letting someone know that you are cared for, you are loved, and that you are more than a diagnosis and a medical record number. That is the beginning of care for me. And we offer compassion. And for me, compassion means to suffer with, which means we join in that experience with you. Although we know it is not our personal experience, that's why we practice empathy. I might not know the exact details of what you're going through, but I do know something about grief and loss and fear, anxiety. The patient that we had, it was an end-of-life patient. They were put on comfort care measures, and we were able to provide what I call a sacred space for listening and sharing. We were able to play the patient's favorite music, some of the sacred text that was meaningful to the patient, and also to be able to help with logistics, because this patient was well loved and had a large family, but unfortunately in the area of the hospital that they were, it could only be 2 or 3 visitors at a time. So we also helped navigate the patient's family and loved ones so they could spend some quality time with them. During these holiday seasons, a lot of families will be experiencing the first, and that's the first major holidays and events where they will be without their loved ones. Statistical data shows that that grief and loss and mourning are increased during these seasons because of just not having that loved one with you and having to navigate all of the emotions that surround it. What I suggest is that you feel the feels, that you make time and room and give availability of yourself to feel what you need to feel. Like I said, I believe that if you try to suppress grief, it will just pop up somewhere else, and probably behavior that is not desired. But if you allow yourself to feel it, if you surround yourself with loved ones, if you allow yourself to hear the stories, to retell the stories, and also seek help. There are a lot of resources we have here. The Pastoral Care Department, of course, being one, but we also have other professional resources that can help people navigate grief during this time. And don't be ashamed. Don't be ashamed. There is no right or wrong way to do grief. I just believe there's a healthy and unhealthy way to grieve. We have the ability to connect patients, families, and their loved ones with a diverse communities of faith. We have end-of-life resources, materials, support groups, and other grief help supports. Just ask. The disciplines here, especially our nursing staff, which is a wonderful staff, they know to reach out to their pastoral care department. We ask that you just call us. Even if the patient doesn't ask for a chaplain, we're part of that interdisciplinary care team, and we're supposed to be called to every death. So when we are called, especially early, we're able to, like I said, make those inroads and offer care that patients and their family members and loved ones might not be aware of. I think it's imperative. Looking at holistic care, if you do the research, you'll find that spiritual care goes hand in hand with medicinal treatment. I believe that when people are allowed to continue their belief systems, or when those belief systems are honored and recognized and supported, that they'll have a more, a better healthcare experience. Well, 2 words come to mind: purpose and fulfillment. This is definitely a calling. A lot of our staff here at UNC Rex are either bivocational or second career individuals. We have people who are engineers, who are pastors, who had executive positions, but in this stage of their life, they feel like they're called to do something different that gives them purpose and fulfillment. So it's a calling. It's a calling, and it means so much to us to be able to do that in this milieu, in the clinic, to be able to teach not only pastoral care as it pertains to compassion and empathy, but also to be taught as a clinician. So the Pastoral Care Department, we're here 24/7, 7 days a week, rain, sleet, or snow. There is always someone here on campus. And we ask that you contact us, that you don't have to work out whatever situation is, you don't have to figure out what resources are available. Just contact us and we can help come alongside. And that goes for patients, their loved ones, and also staff.